Good morning, everyone. Welcome to this morning's Mayor's Media Briefing. We have several guests with us here this morning, and we'll go ahead and get started. First, I'd like to call up Ms. Paula Seibeneck from Ohio Means Jobs, and Paula's going to talk about 2 job fairs that they have coming up soon. Thank you, Paula.
Thank you. Okay, just wanted to let everybody know that we have a job fair this Friday, March 10th, from 11 a.m. to 1 p.m. It's actually with 2 employers at the same time, Diamond Manufacturing and Colonial Surface Solutions. Colonial is in Columbus Grove and Diamond is in Bluffton. And they have a variety of positions available. They have welder jobs, operator, painter positions. So what we're doing on Friday is folks can come and apply. They can also get tested, and we'll pre-screen them, and then we'll send everything off to the 2 employers. So it's a really good opportunity for those individuals looking for employment. These are immediate positions that they need to be filled. But I also wanted to add a couple other employers that are looking kind of some jobs of the week, if you want to call it. The Ohio Department of Transportation, once again, is doing their apprenticeship highway maintenance worker program, and that's a good opportunity for folks to learn how to get what they come out of that program with is a CDL. And so ODOT prepares those individuals for their highway maintenance positions. And then also Oryx Stamping has several positions open. And then just talked to St. Rita's yesterday. They have a variety of entry-level food and nutrition jobs, and they start pretty good. Actually, there's full-time and part-time jobs available there, and if anything, it's a good opportunity for folks to kind of get their foot in the door there. And then lastly is General Dynamics. General Dynamics has also a variety of positions open, including several engineer jobs. So all of that information can be found on our website, or if you want to go to our Facebook page, they are also listed there, or you can simply call our office at 419-999-0206. Thank you.
And 1 second. For the job fair this Friday, what kind of documentation do applicants need to bring?
Okay. Basically just bring anything necessary to fill out the application. So maybe a resume, but even if you don't have a resume, people can come and we can help them do a resume even beforehand or even during the job fair. So, so your work history, driver's license, if you have references of previous employers, that type of information. Anything that would be used to fill out the application.
And your website again?
Is www.ohiomeansjobs.com.
Thank you.
All right, thank you.
All right, thank you. Next, we have Karen Sommers from the Lima Public Library. She's going to be talking about a antique type roadshow that they have coming up.
Yes.
Thank you.
Thank you. So, I'm going to show you this, but I'm not going to hold it up the whole time because this is just a little bit heavy. So this is an illuminated manuscript, and it's called illuminated because the lettering and the little designs on this were created using gold and silver and really pretty paint colors. So it's a 2-sided thing. The manuscript was done on both sides. It was done by a monk somewhere back in like the 11th century, 12th century, thereabouts. It's old. It's really old. And so the library sold these things back in 1930. 1930 through towards the end of 1950. I know that none of you guys were here during that time period, but our hope is that you have relatives who might have purchased some of these from us way back then. So the library started this in 1930 when they met Professor Otto Egge from Cleveland Institute of Art. He was selling these. He was dismantling holy books, missals and Bibles and books used in masses and stuff like that. He took them apart page by page and started selling them to people. He was doing it because he thought that, well, it was a money-making proposition for him, but he also felt strongly that people, ordinary people, should have access to beautiful pieces of art. So that's what he did. And somehow the library kind of connected with him. The library director at the time, Georgia McAfee, was a collector. She had met him somewhere and purchased some of his pieces. She went back to the library and talked about it, and the people there decided that it would be a great fundraiser if he would let us sell his pieces and then give us just a cut from whatever we sold. So he agreed to do that. He said, yeah, you'll probably sell maybe 25 or so, and wasn't expecting a big deal. But they ended up selling almost 6,000 pages of these over an almost 20-year period. And they sold them through the library, of course, but they also put ads in magazines that went all around the country. So they were constantly shipping these out. And the prices were anywhere from 25 cents up to a couple $100. But most of the ones that the library sold were probably up to maybe $25 or $30. And those would have been like ones with really pretty illumination in them, the more expensive ones. Anyway, scholars have been coming to the library for decades to study our files on these manuscripts. So they're an important part of history, and these scholars go around and they try to kind of digitally reassemble all of these books that were taken apart. And so we are very fortunate to have Lisa Davis, who is she has a blog that's called the Manuscript Roadshow, and she has been working with others, putting together digital representations of these big books of manuscripts. And so what we're asking is people to go home, check with their relatives, especially if they have older relatives, and see if any of these manuscripts are in your homes or in your relatives' homes. And if so, Dr. Davis would like to see them. So she's going to be at the library the end of this month on the 30th and 31st. And she is asking people if they could bring in manuscripts that they have. She wants to examine them. She can tell you, like, where a page came from, and she can tell you what century it's from, and she can give you an idea of the value of that page. And for some people, I think that might be really interesting. So we're just trying to get the word out that she's going to be at the library, and she's really a lot of fun to talk to. She just knows so much about this stuff. And it's pretty easy to sign up. I mean, basically, you can show up on the 30th, 30th and 31st. She's going to be doing like an open call where if people bring their manuscripts in, you know how like Antique Roadshow does it on TV? They just sit with the person and they tell them a little bit about it and then they give an estimate. So she'll be doing that. And she'll be there from 9 until noon on Thursday and Friday, the 30th and 31st of this month. And then on Thursday evening, she'll also be there from 5 until 7:30 doing the same thing. Anyone who would like to have an appointment set with her, she's willing to do that too. If you have like a specific time when you can come in with your manuscript, she can accommodate that as well. So anyway, I'm just trying to get the word out, and if you know of anybody, talk to your neighbors, you know, especially if you have some older people living nearby. You know, I think that at this point we're probably talking grandchildren, maybe some children of the people who bought them, but, you know, I don't think we have any 130-year-old people kind of hanging around with these still. So anyway, that is what we are looking for. And, of course, I have just recently learned a lot of information about these manuscripts and have a boatload of knowledge that I don't know what to do with. So come and talk to me, ask me questions, and I'm happy to share. So thank you.
Thank you very much.
Thank you.
Next, we have Ty Bateman from Bridging the Gap. Ty's going to talk about a program coming up in April that's going to be held at Lima Senior High School.
Sure. Good morning, everybody. I am here for Bridging the Gap. We are a group of ambassadors, local community members, women, men, coming together to address the health disparities within the African American community as well as the nation as a whole. But specifically, we try to focus on Lima because this is where we live, and we want to focus on our area specifically. We started off by getting the money or grant through Lima Memorial, and it was a grant to focus directly on breast cancer awareness. So we held a big one-time event for all women. We brought a speaker in to address those disparities within the African American community and how our counterparts differ from us and how we as Black women pass before some of our counterparts in different races. And we moved on last year to having a health fair, it was our first time launching the Minority Health Wellness Health and Wellness Expo. And now we're really excited to keep that going, and it's grown. We are expecting over 30 vendors to be in attendance, and we're really excited about it because it's going to continue to let people know that even if you don't have the insurance that you need or you don't have the finances to really help when it comes to your health, you can get the help and the resources right here in our community. So we have different things. We're going to have so many. St. Rita's is teaming up with us, and we're coming together with Lima Memorial, and we also have the Bradfield Community Center coming, and there's so many different vendors that are going to be there. We're also making sure transportation is going to be provided. Easter Seals and Goodwill are going to make sure that we're going to have different stops to make sure people are able to come to this event. There's different stops at Lima Towers, Dominion, Argonne, Bar Apartments, and Pilgrim Place. We'll make sure that everyone gets that information so that they're able to know what times those stops are going to be and how they can get to Lima Senior on April 1st from 9 to 1 as our time. There's also going to be glucose screenings that are going to be there. And the biggest thing is that when you get the information that you need, there's going to be breakout sessions to actually discuss the different issues that you want to talk about, like dementia is an issue, prostate cancer, heart disease. And then we also have door prizes to get people excited about different things. So you can stop at the different vendors and get the information that you need specifically. Obviously, we have 30 different vendors and more, and you don't have to go to just that one vendor. You can actually stop at just one vendor that you need specifically. You don't have to go to all the different vendors. And again, if we do need vendors to come through, if you are within the health field, that means mind, body, and spirit, whichever it's in that department, we have applications to make sure that you get in. It's all free of charge. We need those vendor applications by March 24th. You can actually reach out to us at our website, on Facebook, I should say, at Lima, or excuse me, Bridging the Gap Lima. If you look that up on our search bar and on Facebook, you should be able to reach out to us and get the information that you need. Again, it's free of charge, but of course the information that you get is of course not going to be free to you, but it's going to be necessary, and it does more for you in the long run. Thank you.
I have a couple questions.
Yes, ma'am.
Are participants required to pre-register?
No, you just basically come to Lima Senior on that day, come on in. We should have different ambassadors that are going to be able to take you around to whatever you need. But honestly, you can just come, show up, look around, and find out what fits your needs.
And then to schedule transportation, would they just be at the places?
Just at those different places. At this point, Easter Seals has a list of where they're going to be. They have 2 different time periods for these different locations that I mentioned. So we'll make sure that that schedule is provided for people to reach out to. I'll make sure that that is also on our Facebook page. So again, that's Bridging the Gap Lima. Okay, thank you. Appreciate it.
Next, we have David Mayhor from UCAN, Ohio. He's going to be talking about efforts in the community, not just the Lima community, but throughout the nation, to give information to citizens about the Affordable Health Care Act. David? Thank you.
Good morning. Thank you to Sharetta for inviting me to come today.
You're welcome.
Greatly appreciated. My name is David Mayhor. I work with UCAN, Ohio. We're a statewide group that works to bring the consumer voice to the table when we think about healthcare and healthcare reform. And of course, these days we're talking about healthcare reform an awful lot. I have a press release that I can give to any of the media folks here today, and I just want to run through it quickly. So a couple nights ago, the House Republicans unveiled their bill to repeal the Affordable Care Act. Until now, the bill has been kept under lock and key. There's been no opportunity for public input on the bill or for estimates on how much the bill is going to cost, and members of Congress haven't seen it, haven't read it long enough to be able to really act on it, and yet they're going to be asked to vote on it. Here are a few of the provisions that are included in the bill that we know of at this point. The bill will effectively force states to end Medicaid expansion, which Ohio did several years ago, and it's helped many low-income people with their health care needs. About 700,000 Ohioans who gain coverage through the Medicare expansion will stand to lose access to their health care. Per capita caps to Medicaid funding will shift costs to the states, leading state budget shortfalls that will force states to cut Medicaid eligibility and benefits. More than 2 million Ohio children, older adults, and people with disabilities may be at risk of losing coverage or having fewer covered services. The bill reduces the tax credits that are available to low-income folks to be able to afford their insurance. And about 238,000 Ohioans enrolled in coverage through healthcare.gov for 2017. Most were eligible for tax credits to make coverage more affordable. Analysis shows that under the bill, they would be forced to pay thousands more. Premiums and out-of-pocket costs like copays and deductibles will rise, especially for older adults, because the bill allows insurance companies to charge higher premiums than under the Affordable Care Act. The bill also provides health care savings accounts. These are accounts that rich or more than middle or low. These will benefit more rich folks than middle or low income folks. Many families can't afford to contribute to health savings accounts. They simply provide a tax break for the rich in our minds. Cuts to Medicaid and tax credits for low income and middle income people under this bill make it possible to cut taxes for the rich insurance companies and insurance CEOs. So this proposal takes health coverage from the poor and gives money to the rich. That's according to Steve Wagner, who's the executive director of UCAN Ohio, the organization that I work for. Americans have asked their Republican members of Congress not to destroy the gains made by the Affordable Care Act. Instead of listening, Republicans have proposed a bill that would strip away coverage and make care more expensive for millions of vulnerable Americans while cutting taxes for the wealthiest. We want an opportunity for our legislators to read the bill, to understand the bill, and to know what the provisions include before they are asked to vote on it. There are a couple of things that we actually would like to see included in the bill. We want to make sure that people who have experienced pre-existing conditions be able to continue to get insurance under the new bill. We want to make sure that women are not charged more for insurance as they had been in the past. We want to make sure that children up to 26 are able to stay on their parents' insurance coverage so that they can stay healthy. And we want to make sure that people understand what's going on. And so that's part of the reason we came last night. We met at the library. There were about 20 folks who came. And we talked an awful lot about what the Affordable Care Act did for them. And most were clear that it helped them in their health needs.
And your organization is encouraging stories from across the state about both positive and negative experiences about the Affordable Health Care Act. Is
That's
that
correct.
Okay. And if someone was not able to attend the meeting on last night, how would they relate their comments to your organization?
You can go to www.uhcanohio.org. That's our website, and we are collecting stories there as well.
Okay, and you guys will forward those to state legislatures?
Correct.
Okay.
Yep.
Thank you for coming.
Thank you so much.
Next, we have Chief Bruce Black from the Lima Fire Department. He's going to be talking about the fire department's most recent ISO ratings. Good morning, Chief Black.
Good morning, everyone. I'm here today to talk about the Insurance Services Office's Public Protection Classification of the City of Lima and the Lima Fire Department. Every so often, I'm going to refer to Insurance Services Office as ISO from now on. Every so often, ISO comes in and does an evaluation of the the fire department, and the water utility system that we have within the city of Lima. The last time that ISO was in the city to do a study of the fire department and the utilities department was in 2009, and through that study, they gave us an ISO rating of 3. The ISO rates departments or areas from a classification of 1, which is the highest classification you can get, to a classification of 10, which means an area that has a 10 rating basically has no recognizable fire protection. So for us, the Class 3 is one of the highest ratings you can get. The only rating that would be higher would be a Class 2 or a Class 1. The rating that we received in 2009 was a Class 3. The overall point score was a 72.81. In November of last year, ISO came back into the city and evaluated the fire department and the utilities department again. And went through that process. We received our score here late last month. Our ISO rating still has remained a 3. It's been modified to a Class 3, Class 3X, and I'll explain that here in a little bit what the 3X is. But basically, our rating stayed the same. But our overall score went up. Our overall score was a 78.74. So we went from 72.81 in 2009 to a 78.74. Well, what does this mean? That means we're only 1.26 points away from a Class 2 rating, moving up to the next level. Excuse me, sorry. But so we feel real good about this our score we received. This score will take effect June 1st of this year. What does the higher classification mean to business and homeowners that are within the city? Well, the property or the insurance industry uses this class rating to determine rates for insurance on homeowners insurance, business property insurance, and so forth. Homeowners see a somewhat small reduction in their insurance rates for a Class 3, say, compared to a Class 5. It's just a small amount. But business owners see a significant decrease in costs. If you would have that same business, say, in a Class 5 or a Class 6 or a Class 9 area, their costs would be significantly more in insurance costs to them. So for businesses that are located inside the city, they see a decrease in costs in their insurance ratings by being inside the city with this Class 3 rating compared to being outside in a higher rating area. The areas that was looked at, if you look at how they look at each area and the points that area gets, there's basically 4 areas they look at. One area is communications. The Lima Fire Department is dispatched by Lima Police Department. They look at the communication network, how many employees they have over there, and the type of training they have. And that makes up 10 points. You can get a maximum of 10 points for communications. The water supply area is basically our water system that we have throughout the city. The piping, the pumps, everything's counted in that. They also look at how hydrants are tested. And the fire department maintains the hydrants as far as making sure they work and that they flow. We go out twice a year. In the springtime, we flow all the hydrants inside the city limits, and we pump them out. And in the fall, we go back and check and make sure that the hydrants do not have water in them. And if they do, we pump them out for the winter. The winter's water freezes, and during the winter, the hydrants need to be dry so that they are available for our use in the wintertime. The one area that we're going to work with the utilities department to improve our score is flow testing, which decides actually what that hydrant, the amount of gallons that hydrant is flowing. So that's one area we're going to work on to try to move our score up. The fire department area, the water supply area makes up a possible total of 40 points of this ISO score. The fire department area makes up 50 points of that possible score. That's the max we can get of that possible score is 50 points. And we got some areas we can work on in there also to raise that score up. The fourth area that they just came out with in 2014 is called community risk reduction. That basically is 2 areas, or 3 areas actually. Fire prevention area, which consists of fire prevention education, and fire inspection and code enforcement. The fire department has a fire prevention bureau with 2 employees in it, and they are the ones that go out to the schools and do fire education. They work at Safety City, and we have a firehouse that kids can go through out there to learn education on fire safety. And they also go into the businesses, and they can go into any residential occupancy that's above three units. So basically our apartment complexes, they can go in and enforce the fire code. The other area is our fire investigation. We do have 1 full-time fire investigator. His job is to, when we have a structure fire, we call him in to investigate the fire to determine cause and origin. If there's been a criminal act, as far as arson, he works with the prosecutor's office to try to get a conviction, if we can, on the person that started the fire. And he also works with the private insurance companies in dealing with their investigators that they bring in for structure fires. So that community risk reduction is 5.5 points of the overall total score. So in actuality, we did very good this time, and we have a goal of next time trying to move up to class 2. So, any questions?
The media may have some questions.
All right.
Thank you, Chief.
Thanks.
And I believe that that is all that we have for today, and thank you all for coming.